I'd like to start by sharing some fairly absurd ideas with you, so bear with me here. Actually, the first thing I'm going to say is true. Most adults need about 7 to 9 hours of sleep per night. Sleeping more than 9 hours a night is generally considered fine and might be especially beneficial for younger adults. In contrast, sleeping less than 6 hours a night, what we'd call short sleep, is associated with a range of negative health outcomes, including diabetes, high blood pressure, and cardiovascular disease. So all of that's true. Now I'm going to get into the ridiculous. Let's just suppose, for argument's sake, that a third of the population sleeps 7 to 9 hours a night, a third sleeps more than 9 hours, a third sleeps less than 6 hours. Now remember, I told you that 7 to 9 hours per night is optimal for most adults. So what I'm going to do then is just group together anything that's not 7 to 9 hours of sleep, and I'm going to label that unhealthy. Now that that's done, I can tell you that we have a sleep crisis in Australia because most adults have a sleeping pattern that puts them at risk for unhealthy outcomes. Makes sense, right? I'll come back to that. I want to share with you the headline of a news article that I came across a little while ago. In this news article, we learn that a tall biomedical scientist who discovered some breakthrough treatment won a prestigious prize. How does that sit with you? What is the relevance of the physical stature of this scientist to the point of this article? I'll come back to that one as well. Okay, last one. Let's talk about myopia for a minute. Myopia is a condition that affects about 30% of Australian adults, and if left unchecked, in the next 25 years, that'll hit 50%. That's actually true. But if we're being frank, really what we're talking about here is an issue of motivation, of willpower. People just need to try harder to improve their vision, right? Instead, what people often do is they take the easy way out, go for quick fixes, sometimes even resorting to pharmaceuticals and even surgery. And it's just because they don't want to try hard and put in the effort. Okay, now that I've got that ridiculousness out of the way, what I really want to talk to you about today is obesity, and more specifically, what I would argue is our overemphasis on weight in the context of health. We are told very often that our weight determines our health outcomes. The clear message is fat is bad. This message is everywhere. We hear it from medical professionals and public health campaigns. We hear it from the mass media. We hear it from the diet and fitness industry. We hear it from our friends, our family, and any random individual on social media who deems themselves an expert on this subject. We hear the idea that fat is bad so often that we take it for granted, as a given. We don't question it. In fact, the mere mention of the word obesity in almost any context is enough for us to immediately understand the significance of the issue at hand. Our willingness to accept weight as relevant in almost any context can be pushed to ridiculous extremes. Remember that news article that I mentioned about the tall scientist? Well, I made that one up. Of course I did. No respectable journalist would ever mention somebody's physical appearance in an irrelevant context, would they? Well, sadly, I modeled that article directly on an actual article that I saw in a newspaper in Australia a little while ago. In the real article, which was about somebody who got caught smuggling firearms, the journalist thought that it was appropriate to mention the perpetrator's weight not once, but twice. So in the headline, we see that an obese mechanic was arrested for smuggling firearms, allegedly terrifying firearms. And then we learn that the mechanic was morbidly obese. Why was it okay to mention the perpetrator's weight in this context? Well, one of the reasons why we view weight as relevant and why we keep focusing on weight and obesity is because we know that obesity is considered a global health concern. Obesity is associated with a range of negative health outcomes, including type 2 diabetes, high blood pressure, cardiovascular disease, and a range of cancers. You may have heard that obesity has or will soon overtake smoking as the leading preventable cause of death. So fat is bad, right? Well, there's a few things that are worth pointing out about this. But before I get into that, it's worth orienting you to how we think about weight and classify people's body weight in this field. The most common metric that we use is what's called the body mass index, or BMI. Essentially, this is a measure that takes into consideration your weight relative to your height, on the understanding that taller people should, on average, weigh more than shorter people. Now, BMI is certainly an imperfect measure, and there's been lots of debate about this over the last several years in terms of its validity and utility. That's a conversation for another time. For right now, it's just important to understand that the bulk of the research in this area uses BMI as a way of classifying people's weight. The World Health Organization has put out some guidelines for how to categorize BMI, and essentially we can look at these values here. So a value of less than 18.5 they would consider underweight. 18.5 to 24.9 is considered normal weight. 25 to 29.9 is considered overweight, and 30 and above is considered obese. Okay, so back to fat is bad. The first thing that I wanted to point out about that statement is there's a word that we often use here that's hidden in the background. We often overlook it, ignore it, whisper it so we don't pay too much attention. Obesity is associated with negative health outcomes. Now that's a far way away from saying that obesity causes these negative health outcomes. In fact, it may well be that the same factors that cause somebody to become obese cause those negative health outcomes. As many researchers have pointed out, when you control for factors that are associated with health outcomes, things like age, sex, diet, exercise, smoking status, stigma experiences, the relationship between BMI and health outcomes is much, much weaker. The second thing that I think is worth pointing out, that's often hidden in the shadows, again, so we don't pay too much attention, is this. The research shows that obesity is associated with a range of negative health outcomes. But those same studies show that overweight is not. In fact, many of these studies show that overweight is associated with a lower health risk than even normal weight. So fat is bad? Let's go back to the example of sleep that I brought up earlier. I hope you saw the ridiculousness of my argument and the flaw in my logic when I tried to convince you that anything that wasn't 7 to 9 hours of sleep was unhealthy and that we therefore have a health crisis in Australia because people aren't sleeping enough. That's exactly what we do when we're talking about weight. See, what we do is we classify anybody who's not in the normal weight together and we label that unhealthy. And then we take that a step further and we say, oh, well, look, the vast majority of Australian adults have a body weight that puts them at risk for negative health outcomes. So we have a crisis on our hands. So fat is bad, right? But that's not what the data show, but we do it anyway. And for your convenience, and lest you get confused, we often will refer to the normal weight range as healthy weight. And we even sometimes refer to overweight as pre-obesity. So now we have a situation in which the majority of adults are convinced that their weight is unhealthy and that they need to do something about it. And that message is getting through pretty clearly. According to the most recent Australia Talks national survey, 60% of adults report that they are currently trying to lose weight. And in a way that makes sense. If having a higher weight is so unhealthy as we are often told, then the solution, the easy way to fix that problem and improve our health is to lose weight. And fortunately, we have a multi-billion-dollar wellness, diet, and fitness industry to help us on that journey. What could really be called a part of a weight loss industry because the objective is often to lose weight. Have you ever heard anybody say that they were giving up on their diet because it didn't work? Even researchers who are concerned with the negative impacts of our diet culture will point to the reams of data that show that diets don't work. But what do we mean by that? What we mean is that the diets are not going to produce the amount of weight loss that you hoped for. Have you ever heard somebody say that they were giving up on their diet because it didn't lower their blood pressure or their cholesterol as much as they hoped? I don't think so. So this brings me to my next point, which is really the core of the argument that I want to make today. The research evidence paints a pretty clear picture that the health behaviors we engage in, the foods that we eat, how much we move our bodies, have at least as much of an impact on our health outcomes as our weight does, if not more so. Let me break this down for you a little bit. There are a number of large-scale longitudinal studies showing, for example, that cardiovascular fitness predicts health outcomes and mortality independent of a person's weight. In other words, somebody who is obese and also fit has a lower risk of dying than somebody who is lean and unfit. Other studies similarly show that when you look at the number of protective health behaviors that people engage in, things like their diet, their exercise, whether or not they smoke, and so on, those are more strongly predictive of their health outcomes than is their BMI. So the data paint a pretty clear picture that the health behaviors matter at least as much as our weight does. But that often gets overlooked in the discourse about weight and health. And if we ever do mention behavior change, it's usually directed at people who supposedly weigh too much, and it's in the service of getting them to try to lose weight. And that's unfortunate because it turns out that these health behaviors matter regardless of your weight and regardless of the impact of those health behaviors on your weight. I don't know how many of you have seen the 2004 documentary Supersize Me. The filmmaker, a guy named Morgan Spurlock, whose BMI was in the normal weight range, decided that he was going to eat McDonald's at every meal and snack for 30 days straight. Yeah, look, quite predictably, it didn't work out very well for him. And sure, he did put on a bit of weight. But the most concerning thing and surprising thing was the impact that that diet had on his health outcomes in that short period. His cholesterol was elevated, which is an increased risk of heart disease. His uric acid was elevated, which is an increased risk of kidney stones. His liver enzymes showed a 10-fold increase, which means that he was already showing early-stage signs of liver disease. On top of that, he was experiencing low mood, he was experiencing fatigue, he was experiencing low sex drive. So following a poor diet like that is bad for your health regardless of your size. But as long as the public health messaging remains focused on weight as the ultimate predictor of health, then people who are not of a higher weight are going to think that they don't have anything to be concerned about. They would be wrong. The flip side of this is also true, that improving your health behaviors, eating more fruits and vegetables, reducing the amount of fat or sodium in your diet, being more physically active, all of those things are good for your health regardless of what they do to your weight. In fact, the research shows that the health benefits of improving diet and exercise are observed even among people who never lose any weight and are actually uncorrelated with the amount of weight lost. So isn't it puzzling then that we continue to focus so much on weight as the ultimate outcome and as weight loss as the ultimate goal? Let me repeat myself. Health behaviors are important regardless of your weight and regardless of the impact of those behaviors on your weight. And here's the kicker. Those behaviors, that's actually something that we have at least some degree of control over. The weight, not so much. One final point I want to touch on has to do with the social stigma associated with a higher weight. Perhaps because we live in a culture in which we are so often told that higher weights are bad for our health, that tired statement that fat is bad, people seem to feel justified in making negative comments towards people who have a higher weight, commenting on their body size, ridiculing them, telling them what they should and should not eat, and much, much worse. This stigma is everywhere. It's perpetrated by friends, family, strangers, and even the health profession. You might remember a few years back, the public health minister in the United Kingdom made headlines for her stance on obesity. Effectively, she was arguing that we need to stop sugarcoating things and we need to treat this problem with the seriousness that it deserves. One of her recommendations, therefore, was that we stop using the term obese in this context and instead refer to these patients as what they are, which is fat. Now, her reasoning was that if you think about your weight in medical terms like obesity, then you're not going to really be motivated to do anything about it. So we need to take a tough love approach. We need to give these people a kick in the pants so that they're willing to make those changes, and calling them fat should do that. If we go back to the example that I brought to you earlier about myopia, I was trying to make the case that this is a ridiculous point to start thinking about something like myopia in terms of effort, of willpower, that we just need to try harder to see better. Sure, we know that myopia, part of that is due to people's behaviors and environmental factors. But we also know that myopia is largely genetically determined, with around 60 to 90% of the variability in the population resulting from genetic factors. Another human characteristic that also has a strong genetic component is height. And we certainly don't chalk height up to willpower. We just need to try harder to be tall. It turns out, though, that weight also has a strong genetic component on par with these other characteristics. Yet somehow we have singled out weight and obesity as being contexts in which we can talk about willpower and motivation and putting in the effort. So going back to the example from the public health minister who said that we should start using fat when we're referring to these patients, the idea is that this should be a sufficiently negative experience for them that they are finally motivated to do something about their weight. That's what it would take, using a schoolyard taunt. Because fat is bad, right? It turns out that, look, that's not how weight works, and that's also not how stigma works. Stigmatizing somebody because of their weight is associated with disordered eating behavior, including binge eating. It's associated with lower motivation to diet and exercise, and lower confidence in one's ability to change behavior. Stigmatizing somebody because of their weight is associated with weight gain over time, not weight loss, and is also associated with a range of negative mental health and physical health outcomes. So look, this might come as a shock, but it turns out that treating somebody like garbage, even if you think you're doing it for their own good, doesn't actually help them. Look, if you've been listening to everything I've had to say today, and you're still sitting there thinking, oh, but how do we stop them from being fat? Then you really haven't heard anything I've had to say today. So let me summarize briefly. First, I encourage you to take a more critical stance when it comes to the prominent weight-focused narrative that we hear in public health circles, in the mass media, and even among lay people. Second, I've tried to make the case that it's time for us to get over weight and instead focus on increasing health behaviors, because those health behaviors matter regardless of their impact on your weight and regardless of your weight. And finally, if I may be so bold, perhaps we could try and treat people with a little bit of dignity and respect. Thank you.